I'm national correspondent Kayla Gaskins in Washington. President Trump released his long-awaited health care plan Thursday, but critics point out it's thin on details. It's called the Great Healthcare Plan.
It's the biggest thing to happen to healthcare, maybe from the beginning.
It focuses on lowering drug prices, lowering insurance premiums, holding insurance companies accountable, and maximizing price transparency.
We're going to get tremendous reductions, as you know, through, if you look at medicines and prescription drugs, they're going to come down by numbers that have never been seen before.
The framework also includes a policy to send payments directly to households to cover health care costs, as opposed to the current system that sends federal subsidies to insurers on consumers' behalf. Critics pointing out specifics on how to achieve these goals are scarce.
I'm calling on Congress to pass this framework into law so that we can get immediate relief to the American people.
Notably, Trump's plan rejects efforts to extend the Affordable Care Act subsidies.
This guy's had 10 years to come up with a health care plan. Instead, they cut health care for 15 million people. They raised all of our rates in the process.
On Friday, President Trump held an event at the White House promoting his $50 billion rural health initiative.
For those that were trying to make a case that we weren't taking care of the rural community, I'm all about the rural community.
Republicans added this initiative into President Trump's signature piece of legislation, the One Big Beautiful Bill, after warnings from GOP lawmakers that planned Medicaid cuts could disproportionately harm rural hospitals.
It's focused on letting states and governors design the system that they need. Alaska has many unique healthcare challenges, Mr. President, as you know, but for decades, the mentality in Washington, D.C. is this approach to one size fits all, and it never works.
Still, analysts note the program's $50 billion price tag pales in comparison to the $911 billion worth of Medicaid cuts the Congressional Budget Office estimates the One Big Beautiful Bill will make over the next decade. In Washington, I'm Kayla Gaskins.